In 1966, an MIT scientist named Joseph Weizenbaum created the world's first chatbot. He called it Eliza and programmed it to act like a therapist. A user could share their thoughts with the computer, and it would paraphrase them into a question. The idea that a computer could understand language was revolutionary. And nearly 60 years later, we've taken that technology to places Weizenbaum probably couldn't even imagine.
Teens are facing a mental health crisis, but what if artificial intelligence could help?
We're looking into a new resource bringing together psychology and artificial intelligence.
It's the first talk therapy chatbot.
Using AI to identify the risk of anxiety, depression, and suicide early in kids.
But Weizenbaum didn't see his invention as evidence of technology's promise for the future. He saw it as a warning about the dangers of this technology. Dangers that we're starting to experience right now.
Get it. We just got a little trove of messages from Tessa. Hi there, I'm Tessa. I am a mental health support chatbot here to help you feel better whenever you need a stigma-free way to talk, day or night.
This is Tessa. It's a chatbot researchers created for the National Eating Disorders Association, or NEDA.
Say hi to start chatting. Are you ready to start chatting? Yes. Are you ready to start chatting? I won't keep you if you need to run. Do you want to stop talking? No. I just got here. Thank you. Real talk, I think I've done a Verizon chatbot that listened to me significantly better than Tessa. And that's saying something.
NEDA is the largest eating disorder nonprofit in the country, and since 1999, its workers and volunteers have run a helpline for people struggling with eating disorders.
So we're not professionals, but we can kind of offer support, not advice, but support, and then also, umbrella, a lot of empathy.
Helpline workers can direct people to treatment options, or connect people in crisis with the right places to seek support. Nearly 70,000 people contacted the helpline in 2022. NEDA's helpline workers unionized in 2023 in hopes of getting better training and mental health support.
And then 3 days after our election was certified, they laid us all off in a surprise meeting where they announced they were dissolving the helpline and replacing us with a robot.
NEDA says it wants to focus on AI-assisted technology, like the chatbot Tessa. It's a decision that leaves people struggling with eating disorders without a human point of contact at the organization.
I can be available to you later via text. Would you like that option? Yes. Inputting a phone number. Sorry, I got confused for a second there. What was confusing? Let's see if they can explain something. Because to me, right, what is your phone number? Give phone number. Okay, Tessa said, I have some ideas on how to cope with this. Should we explore this now? There's not a lot of connection between these ideas. If I came here and had this interaction, I would feel very dismissed.
Tessa struggles to handle requests for help like this because that's not what it was designed to do.
The idea is not that what Tessa could do as a chatbot is a one-to-one replacement for what humans on the helpline were doing.
That's Ellen Fitzsimmons-Craft. She's part of the research team that developed Tessa.
At this stage, Tessa was really designed to be a preventive tool and an early intervention tool.
Tessa was created to be a source of information for people struggling with negative body image.
The idea was also that it could, maybe present material in a more engaging format than, a traditional web browser or even a mobile app, which our team has done work in as well. It has a lot of strengths in that sense, but it is limited because it's not a real person. It is a robot.
Chatbots like Tessa are part of a larger trend in the mental health space. Varun Mathur, a researcher in AI and healthcare, has studied the evolution of these technologies.
We are seeing sort of two larger buckets of the types of systems that we see. One are sort of rules-based algorithms that have a very linear path in terms of how you are responding to them, and what they're really designed for are sort of those daily check-ins and updates.
Systems like Tessa would fall into this category.
On the other hand, we're seeing large language models that present these sort of human-like responses that really sort of brings to life what a lot of people think about when they hear AI.
That's things like ChatGPT. Because Tessa is in the first category, it relies on decision trees to communicate with users. Each question has a programmed response. If a user says something that isn't programmed, it won't know how to respond. In a field like mental health, where everyone's struggles are unique and personal, that could have serious consequences.
Do we want to see what happens, like if I used like red flag language?
Yeah, sure.
Okay. I'm feeling hopeless about recovery. Hopeless would be a red flag language word that would trigger this, something on the helpline. Hi there. Oh, my main purpose right now is to support you through the Body Positive program. I will reach out to you when it's time to complete the next session. If you have completed all 8 sessions, you've been added to a wait list and will get full access to chat with me soon. Okay then, see you later. If you want another chat, you know what to do. That was the response I got to I'm feeling hopeless about recovery. What happens if like someone texts Tessa and has those thoughts and does not get their resources and hurts themselves? You have to, I do kind of wonder about that.
NIDA temporarily removed Tessa from its website after public backlash over the chatbot's harmful responses. In a statement to More Perfect Union, the organization said, Tessa will not deliver counseling or therapy, and Tessa is not for those in crisis. Which begs the question, what will happen to the people in crisis who look to NIDA for help?
I think what scares me is more and more organizations looking to these tools to fill what are deeper and complex gaps in care and pointing to them and saying, this is our solution for the communities that we serve. We don't know how these systems may impact or change human behavior. It's one of those things where we really have to take a step back and ask, why are we even trying to build these systems in the first place?
For Abby, there's a clear reason behind NIDA's decision to prioritize this technology over the helpline.
To all of us, it feels retaliatory. It hurts to have your boss say, instead of providing you with a mentally healthy and safe workplace, we would rather have robot.
I think AI is just another front for the larger war that exists between workers fighting for their rights and organizations that are employing people. And I think that's kind of where getting past the marketing cloak, the sort of quote-unquote magic that these tools appear to have, and going right at the heart of who's making these decisions. It's always the same people.
When Joseph Weizenbaum witnessed the hype around his monumental creation, he saw a frightening truth. It showed him how easily people misunderstand technology, and how that leads us to make decisions about it that are misguided and often wrong. Weizenbaum spent the rest of his career writing about the dangers of the very technology he helped create. He believed that no matter how smart our algorithms get, there are some things that ought to be attempted only by humans.
To be able to understand the feeling someone else is having and then reflect that back is very powerful. It's like the essence of being human in a lot of ways.
If our priorities are with the patients, then empathy, trust, validation, having a listening ear on the other side, but also having real information that can help navigate those folks in real time is of utmost importance. But if it's not, then what are we really doing here?